Welcome back to Made to Be Whole. Stay tuned for this week's very special episode with guest Megan Krych to talk about her journey with autoimmune encephalitis.
Made to be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So we're very thankful to have Megan on the show. Megan is one of my star patients. Thank you for joining us, Megan.
Thank you for having me.
You're welcome. So I invited you on because you've had a long journey, but it's been successful and you've been very patient with the process of healing, which it's not over, but you're on your way. Do you mind sharing with people just a little bit about, in retrospect, when symptoms started, how they progressed, and what got you to the point of diagnosis?
Yeah, so late 2018 was when I really just started this journey. I started getting hit with what we know was POTS, but we didn't know it at the time. And then that just kind of erupted into more symptoms, and it took to about 2020 when I got diagnosed with Lyme and Bartonella. And it took about 5 more years to get diagnosed with autoimmune encephalitis. And that has been its own journey because I've had this insane treatment-resistant anxiety and panic. Um, I thought I was gonna be like this forever. And then one day you gave me supplements for anti-inflammatories, and they started working for a week, and then it stopped working. And I think that was just kind of all right, we need to get you tested with the autoimmune brain panel,
Mhm.
and that was positive. And
What did that feel like to get the positive result? Was it affirming,
oh, it was
terrifying, both?
validating. It was it made me feel less like a freak, and that I had a chance at actually regaining some of that normalcy back in my life. Because some of the symptoms felt very irrational, like separation anxiety as a 30-year-old. Um Not feeling like I can sleep in my own bed by myself for years. Feeling not okay being home alone, something that I used to actually love. Um, so yeah, it was very validating having a name and a reason as to what was going on internally. And yeah, that was as much as I didn't want it to be positive, I also was kind of happy in a weird way because I knew that there was an actual treatment, and then there's a way to just regain my life back.
Right, and there's a name for it. I think, two of the things you brought up, I think, are really important if people are just starting to learn about autoimmune encephalitis, which some people call pandas. But first of all, it's episodic. So that drives you crazy. It's like you're fine, you're
Yeah.
not fine, you're fine, you're not fine. And it's really hard sometimes to figure out why, because logically nothing's changed from the week before, the month before, when the same experience affected you totally differently. But then also that it can happen not just to little kids, because I think with kids, that regression is easier to see, like, oh, they were potty trained and then they're not.
Yep.
Or, they had this motor skill and then they didn't, versus you're an adult, so you still look and walk and talk like an adult, but it's that the emotional regression, like you said, of not knowing, wait a minute, I love being alone and nothing's happened
Yeah.
to make that unsafe, but my brain does not feel safe.
Yeah. I would just get danger alerts in my brain.
Right.
Yep.
Well, and the whole anti-inflammatories helping, even though it was temporarily, is such a great clue. Anti-inflammatories, I think, are like the best cheap first level tests. If an
Yeah.
anti-inflammatory makes your anxiety better, then your anxiety is related to inflammation, and we just have to
Yeah.
figure out why. But like you pointed out, the madness with this is you take something, it works for a while, but then the process just gets away from you, and the same things that worked don't
Yeah, that's when
anymore.
you kinda explained too that my brain might have created, like, antibodies against,
Mhm,
like, that, and that made a lot of sense, and then I started reading, like, Brain on Fire, and yeah, it just like, I didn't have, like, the symptoms like seizures and such, but,
mhm,
like, I feel like reading about, like, pans and pandas, I was able to go, "Okay, this makes sense." But yeah, having it just be, like, this pediatric, like,
mhm.
illness, definitely threw me off as a 30-year-old.
Well, and I think that's why I like, even though PANS pandas is easier to say, I like
Yeah.
saying autoimmune encephalitis because that's actually what it is, and then it
Yep.
doesn't create this false, "Well, but she is a grown-up. She can't have
Yeah.
this pediatric disease." Because I've had, now, granted, I haven't tested all of my patients, but the oldest person I've had come back that I've tested with positive results was in their 50s. Now,
Wow.
granted, I think they had had it for a very long time,
Yep.
but I think using that kind of precise language is really, really helpful. But you
Absolutely.
fall into that category with chronic encephalitis. That's where a lot of the medical community and sometimes friends and family that are not super affirming or understanding, because the medical world, they think of the brain on fire person. Well, it's this
Yep.
acute, sudden onset, dramatic versus someone who is still walking and talking and trying to work and do things, but is dying on the inside,
For sure. Yeah.
so to speak. So what was it like trying to explain this to family and friends?
My parents were, like, super understanding. I think the second I brought it up to them, they were like, "Okay, this
That's
changes things
awesome.
a little bit," and it also was validating for them as well because they had, like, other people that they would explain it to, and they would just go, "It's just anxiety," or "It's just POTS," or, um, yeah, like, just Lyme, and I think them having a name for it too was just as validating as it was for me.
And
Yeah.
you've been really on board with getting kind of the whole treatment picture, because some people think you just treat the immune system. Some people think, nope, you just have to treat the cause, the infection, but you have to do both. So you are getting IVIG, and
Yep.
thankfully that went through with your insurance with some bumps, but
Yep.
eventually we figured out the words they wanted to hear and
Yep.
the right way to do it for your insurance company. And how many IVIG treatments have you had so far?
I just actually finished up my 7th round, and I do them in, like, 3 days. I did
Okay.
that last week, so and I actually get, like, weirdly excited to get them now.
Well, and can you tell people a little bit about that progression? Because I know I've mentioned to you, sometimes people say, we tried IVIG, it didn't work, but they've only done one or they've done
Yeah.
two, and there's maybe temporary gains or no gains, but it's not sustained. So if you don't mind saying, like,
Yeah.
here was the first one, here's how it progressed, and here's what happens now.
The first one made me go, "What did I get myself into?" I did it at a cancer center, so it was way now I do them at home, which is nicer. But I did it at a cancer center and the dose was too high and too fast, and it gave me probably like the worst headache I probably ever had in my entire life. But I did notice some relief because I had like 3 concerts that I had to go to that month, and I was able to do them with, like, little anxiety, which is something that would typically, like, give me massive anxiety. The second one, it took a little while for home infusions to get approved by insurance, but once that happened, the second one was still kinda hard too. I wasn't able to do the full onboarding process. That was, like, a 5-day stretch, and I got through to day 3, and they had to stop because I was getting fevers, which I'm sure could just be like a Herx response.
Yeah.
But then once we started getting into like the momentum, it started getting easier, but I didn't really notice much of like a change until about round 5. And that's when I started noticing like my anxiety getting lesser. I get these like brain shivers is what I call them, or brain zaps. Those have almost like they've diminished. I typically have this thing that I call wonky eye where like my eye like over focuses and that's starting to completely like go away. So it took a while before I started actually noticing like real changes or
Right.
like sustainable change.
And I think you told me it's gotten to the point now that when you're doing the infusion, you work from home, you're still able to
Oh
work and
yeah.
do normal activities.
Yep.
It's not like you're knocked out or anything.
Yeah. I do work from home while I'm able to do it. The first half an hour is a little rough with IV Benadryl.
Mm.
But other than
Mhm.
that, yeah, I do work from home while doing it.
Well, and you can customize the treatment in that, like for you, when we did the genetic testing, you can have a
Mhm.
paradoxical reaction to steroids, we found
Yep,
out. And thankfully, you remembered that. And we were like, okay, no steroids, because steroids for some people are helpful pre infusion. Like they
for sure.
decrease inflammation, they can help the die off. But for some people, they're just not a good idea. It's doable. But I think that's why for you, running it even slower is a good idea. You know, some people
Absolutely.
I'll do over 2 days, but I just think, "Why rock the boat?"
Oh,
Let's
yeah. I
just
like the way we do them. Yeah.
yeah. Would you tell people too a little bit about the home infusion process too? Because home IVIG, I think, is preferable for most people. I really like it, and
Yeah.
you've thankfully had a really positive experience. Can you tell people a little bit about what that looks like, what it's been like working with the nurse?
Yeah. I love my nurse. She's very like holistic and it's nice having like somebody just like next to you throughout the entire like my infusions are about 4 hours. Um we literally talk, we watch TV, we've gone outside and done the infusions. It's just way more relaxed. The cancer center, it you're like in like your own little like cubicle, it feels like, and it's just is I feel like it's easier to get like overstimulated there. Um,
Well, I was just gonna say, if you have a condition with brain inflation and environmental stimuli is a trigger, and then you're in a place, not that I'm sure it wasn't loud or chaotic, but it's unpredictable noise and
yeah,
movement.
yep.
Yeah.
And like I'm a type of person that likes dim lighting too. So like the
Mhm.
bright lights in like a cancer center was not fun per se.
Right.
Um, so it's way more relaxed at home.
Well, and for people who aren't aware, at home, you can still have all of those kind of emergency measures in place and meds that we would have at the clinic. So they've got access to Benadryl, Zofran,
Yep.
steroids for people who need steroids. They've got those kind of standing as needed orders to help navigate it, because the fact that IVIG made you feel worse at the beginning, kind of like with sometimes antibiotic treatment, that's a good thing. I mean, it's
Yeah.
not it's not a fun thing, but I always say if you're herxing, it's worksing. You know, if your immune system's working better and you're feeling it here, well, we know that's where your infection and symptoms are. That means things are getting
Yeah.
set into motion. Did you have a lot of fear or anxiety surrounding the die off, the headaches, the nausea, the sorts of things that were a little rougher at the beginning?
Oh yeah. That first infusion, felt like I was teetering on like almost like meningitis. So that
Okay.
was definitely like a fear. But then once and like also I was getting like this really, really bad head pressure, like anytime I'd bend down. But I remember reaching out to you about it and you're like, that's normal, that's your immune system kicking on. And also the fact that it's in your head means that it found the source.
Right.
Um, so I feel like you've always been able to give me like reassurance in that aspect.
So I have a question. How are
Mhm.
you, and I'll give you a little background before I make you answer, but how are you able to believe me? Because I tell that to people, but you know, anxiety and OCD is loud and obnoxious and it's
Yeah.
yelling at people. I don't know if you can trust her. Like, what if something even worse is happening? How? Because I've actually used you as an example of a model portal patient to some of my staff because you would reach out and ask for reassurance, and I would give it, and you'd say, "Okay, thanks." And I'm like, I don't know how she manages to do that because it's hard. It's hard.
Yeah.
So walk us through how you're able to get to that point of sticking with it even when it did make you feel worse and your anxiety was ramped up.
Honestly, just knowing that eventually this will work. And also
Right,
just like I have full trust in you. And like you literally found out something that two doctors prior couldn't figure out. And that's something that like that's huge.
right.
Yeah,
Well, and hats off too though to you and your family for being willing to do the testing
for
and the
sure.
hard different things
Yeah,
because
they've been
I
awesome.
know. Yeah, well, it is. It's a big act of trust and it's scary, but at the same time, I living that way is awful too. And
Yeah.
if I knew another way out, like I would tell people. I don't have any vested interest in anyone having to do these prolonged treatments or seeing me a long time,
For
but
sure.
I having everybody be on board, I'm sure it's gotta help you too. I know unfortunately
Yeah.
some people don't have people in their court saying, "No, we believe you. This makes sense. We'll
Yep.
stick with you on this." What advice would you have, I guess, if you were to take different phases of your journey for people who maybe haven't done the autoimmune brain panel yet? What was the value in that? What would your advice be to someone who's kind of on the fence about whether or not to do that test?
Um, it sucks because it is an expensive test, but
Right,
I feel like what you can gain out of that, um, like the fact that we did it and we didn't know what the results were going to be, but we knew whatever results we got, it was going to point us into a different direction. Um,
right.
my advice is to do it, um, because it can open up other opportunities for you for healing and treatment.
And it helps us too as providers. Like it is a very, very good test, even though there are, anytime something is kind of cutting edge, there's going to be doubters. And there are, I think, not to wax too political, philosophical, but forces at play that like keeping people chronically ill. Like our
Yeah,
healthcare system isn't built to help with this process,
yeah,
but it's so helpful because it's positive. It helps us get insurance coverage, but even if it doesn't, it gives us then confidence to find other ways to get it done. You know what
for
I
sure.
mean? And if it's completely negative, it helps us look the right direction too. I mean, it's
Yep,
possible to have a false negative, but it helps make sure we're putting our resources the right places. Okay, well, maybe in this
absolutely.
person, we need to really be more aggressive with the infection or with cognitive behavioral therapy or other things. One thing you said to me once in an appointment, if you don't mind addressing, you said once the treatment started working, it was a lot easier to use all of those things you had learned with counseling and mindfulness. Like you had
Sure.
known them before, but it was really hard to make them work. Can you talk
Oh,
to that a
yeah.
little?
I feel like it's easier to just like calm myself down now, but like
Mhm.
because my brain is like getting less inflamed. So it's
Right.
easier to like rationalize with myself. Yeah.
Well, because that inflammation is such a barrier. You had the skills and the knowledge before,
Yeah.
but it's kind of like telling someone to calm down when they're still bleeding, like, "Don't
Yeah.
worry about it, don't worry about it." Well, like, "No, I'm actually bleeding right now," and so I think with the inflammation, your body also knows, like, "No, something is wrong. I can't just
Yeah.
calm down."
If I would,
Um,
I would
you
if I
you
could.
totally would have been on board with that, but I
Absolutely.
just thought that was really insightful. I remember you telling me that because I thought, "Oh, there's so many people who they're just getting told, like, just do more deep breathing, just" you know what I
Yeah.
mean? Like, "Work harder, try harder," and
Oh
it's
yeah.
so much bigger than that.
Yeah.
What would you say to people who have concerns or fears about IVIG and that process? Because obviously there are bumps. If you could go back to Megan, pre IVIG, what would have been helpful to hear or know?
Definitely pre-meds are important, and I think that was one of the reasons why I struggled with my first 2 infusions. Um, that's something that I wish I would've known, um, that it's normal to feel kinda like crap after an infusion or
Right.
during the infusions, um, but to also stick with it.
Yeah.
Even when you don't notice it, there's probably some changes happening that you just can't see yet.
Right. Right. And if it's years of kind of like suffering and damage, it's not going to be
Yep.
instant undoing of that.
Yeah. I mean,
It's
I had thought maybe by, like, because I read the internet, that
right.
it says, like, yeah, 3 months of IVIG should get you back to, like, kind of like a normal state, and so,
Right.
like, I get to, like, my 3 months and I go, it's not working."
Right.
And, yeah, I guess I just didn't know that, like, if you have years of this inflammation, it's gonna take
Mhm.
months, if not years, to undo the damage, and
Right.
yeah.
Because you really are getting, kind of an immune system transplant. And
Yeah.
if you think about what a big deal a transplant is when you hear about organ transplants and things like
Yep.
that, but we know that it's this big process, and
Yeah.
getting the body to accept it. And so you're kind of getting a new immune system a little at a time, and the immune system's coming in and going like, "Oh, there's a lot to do here. Where do we start?" You
Yeah,
just
there really is, but, like, some of the changes that I noticed right off rip were, my allergies got, like, 10 times better. I used to be,
yeah.
like, taking half a Benadryl almost nightly, and, I stopped doing that within, like, the first 3 months of IVIG. I noticed that I was like, "That's nice that you're getting rid of my allergies, but can you help with the anxiety?"
Right. It wasn't at the top of your list
Yeah,
of
no.
concerns, but but I think, one thing I've thought with situations like that, allergy, sometimes it's like surface level things get taken care
Yeah.
of first, and then getting deeper is harder and takes
Yep.
more time, but you've definitely stuck with it. What would you say at this point in your treatment that your month is more consistent between sessions?
Yeah, absolutely.
Okay. Can you when you say you were looking forward to this last one, can you feel when you're starting to need it again, or you just know that it helps you?
Yeah, I haven't felt like I needed it. It's just more or less I feel like I've seen how the past 2 months have gone, and I'm just like
Mhm.
excited to continue to do it because now I'm
Right,
starting to break out of my shell again.
right.
Um, and it feels really awesome, and I feel like I experience way more joy in my life.
I was actually just gonna ask you, do you feel like you can enjoy things now that you couldn't enjoy before?
Absolutely. Even just like going to like the grocery store, put my
Right.
brain into like red alert, and
Mhm.
yeah, like I've been starting to hang out with friends again, and going to concerts doesn't immediately make me go I'm super scared.
Right.
Um and just being like ever so slightly a little bit more spontaneous, which is something that I
Good.
could not do. I had to
Well,
have
because
a full
spontaneous
plan.
not safe. Now, what about physical changes? Have you noticed anything as far as strength, stamina, those sorts of things?
Yeah, so IVIG definitely helped me like lose weight. Like just like inflammation weight. Um,
Mhm.
definitely is helping me with stamina because ever since I've been doing IVIG, I feel like I am able to like walk longer.
And that
I
was
want to
something you were
start jogging
doing and
too.
trying to do before, but it
Yeah.
seemed like it would be
Oh, I'd be out
you'd
of
say, "Oh,
breath.
I'm doing better," and then it was harder again,
Yeah.
which didn't
It's
make sense.
yeah, it's more consistent.
Good.
Yeah.
And then along with that, have you had pain? And if so, has the pain changed at all?
As far as pain goes, I feel like my only, like, pain region that I get is, like, the costochondritis.
Uh-huh.
That one I feel like once I start treating, babesia, I feel like that'll, like, kinda
Yeah.
hit it a little
We'll
harder.
get
I don't
to it.
know. Yeah.
Well, and the other thing about that that's just of note, that's cartilage, and cartilage does not have good blood flow. So that's when we talk about those hard to reach places, like, the allergies
Yeah.
got better first, and then there's the brain, and then it's just more and more, but then as your immune system works better, then the babesia treatment's gonna be easier to tolerate, and
Yeah.
it's very symbiotic. You can't take away one piece of it
Yeah.
or the other. Now, what I know this is all hypothetical, but if you were in your position but didn't have the sort of family support that you have, what would be helpful? What would you say to someone who might be in that position that would help navigate something that's pretty tricky and again, you're already in a vulnerable position where you don't feel safe and you know you need this treatment and family's kind of like, "Yeah, I don't know. Is this real?" Any thoughts? I know I didn't give you any warning on that loaded question, but
No, it's fine. That's tough because I feel like without my family's, like, support, like, both, like, emotionally and financially, it would have been a little hard. But if you can financially swing it, whether you use, like, a payment plan or you have the funds, I would
Mhm.
say getting that test and then sliding the paper and of results to your family would be, like, a
Mhm.
good way to, like, have them maybe understand you better. And because I know a lot of people don't really like when they see just anxiety, they go, "You're just anxious." And
Right,
it's tough to, like, explain that, "Hey, like, it might be more than that."
right.
But I feel like sometimes just having results is, like, the best way to start.
That's a good point because then they can do a little research and reading on their own, and it's not you
Mhm.
doing the seeing, it's kind of letting the data talk, and then I think having like you said, if you have the resources, having the courage to move ahead, even if not everybody's saying, "Yeah, this is it," because
Yeah.
as they see the changes in you it also is another reason why I think that home IVIG is such a great option because when you go to clinics and there are good clinics out there, but a lot of times not only do you have the like more chaos in your environment, you don't always have the same staff.
Yeah.
Having someone who comes and is just there for you to sit with you through it,
Yeah.
make sure you're safe. It's like you can build your own little support system on your own.
Absolutely.
So, um, what do you feel like now when you think about the future? How do you feel compared to maybe a year ago?
Um, a year ago, I'm trying to think where we were with treating. Oh man, I was on the
All
struggle
blurs
with
together. I know it's incremental, but I guess just even pre-diagnosis and treatment, when you think about the future now versus before you knew what the name of all of this was, do you have more hope and optimism?
Yeah, 1000%. Yeah.
Okay.
Like, I feel like I have, like, a lot to look forward to, and I already am, like, super grateful, but, like, yeah, with the continued infusions, I am super hopeful that I can start doing more things and just, like, enjoying my life.
Well, and I'm really proud of you for sticking with it and for not letting the fear get in the way of getting better because it's hard. And being patient with us as we were trying to navigate. It's so hard from the clinic perspective because everybody's insurance is different.
Oh,
Everybody's
yeah.
situation is different. You can't have this, here's what we do, and it's just going to work. And so you have done a great job being patient and kind to us too as we've tried to figure out the best way to help this and I think your courage in sharing your story it's really important for people to know it's not just you. Like, you're not it's
Yeah.
so isolating. It
It
feels
is
very, very
isolating, yeah.
isolating, but to know, no, there are other people who have done this and they're getting better and I can too. And the idea
Absolutely.
of sticking with things long enough to give them a chance,
Yep.
and it's still not that, oh, this treatment will work as great for everyone as it is for you, but you don't know until you give it enough time
Yep.
until you let your body get used to a new normal.
Absolutely.
Any parting words of advice to other Megans out there who are in various stages of this um, unexpected and unwelcome adventure, but that that does definitely lead to growth if we let it?
Yeah, stay the course because it does get better. Even if you
Okay.
don't feel it in the moment, it does get better.
It doesn't mean it won't. It doesn't mean it
Yeah,
won't.
for
And
sure.
to not and I think too, just kind of encapsulating what you, I think, have done well is to acknowledge your fear without letting it completely control you.
For sure.
And that's it's a tricky balance because you can't just say, it's not real. I know I shouldn't feel this way. What's wrong with me? What's wrong with me?" You have to acknowledge
Yeah.
like this feels awful. This is how I feel and
Yeah.
it stinks. But at the same time, this isn't what I want. And
Yeah.
don't if you're not able to do hard things, it's not going to get better on its own.
Yeah, I was
That's
not willing to settle for this type of anxiety for the rest of my life.
no, you've got a lot of years ahead of you. You want them to
Yeah.
be good years.
Oh, I think they will be.
Well, thank you very much for joining us. I really, really appreciate and I would encourage anyone else out there who's dealing with autoimmune encephalitis in any stage of treatment to remember Megan's story and to remember that there's always hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.